Hi guys, welcome to our debate over neurodiversity affirming practices.
My name is Charlie Broussard. I live in Lafayette, Louisiana, and I have been an RBT peer leader at my ABA clinic for 2 years. I have a bachelor's degree in speech language pathology, and I am currently working towards my degree in ABA. I have provided services in home, in schools, and in clinics. My role for this debate is to summarize the point being made, research critical information to support the argument, and give any key information needed for the audience's understanding.
Hi everyone, my name is Stephanie Mewborn. I live in Grand Rapids, Michigan, and I have a bachelor's degree in sign language interpreting with a minor in healthcare management, and I will soon obtain my master's degree in ABA from Ball State University. I currently work as a behavioral tech and a student analyst, and I provide in-home services to clients. I'm also a parent to a child diagnosed with autism. My role in this debate is a researcher and a fielder.
Hello, my name is Reagan Patton. I currently live in Ocala, Florida, and I hold a bachelor's degree in applied behavior analysis from Ball State University and will soon be obtaining a master's degree from the same university. I am currently working as a student analyst at my current clinic, and we provide in-home, in-school, and in-clinic interventions for EI children. I am the introducer and the fielder.
Hi, everyone. My name is Robin Enriquez, and I live in Northwest Indiana. I currently hold a bachelor's degree in ABA from Ball State, and I hope to finish my master's degree from that same university this summer in July 2024. I currently work as a hybrid supervisee with a multidisciplinary clinic that provides services in clinic as well as contracted through schools. My role in this debate will be the illustrator.
The debate will take place between two opposing viewpoints. The neurodiversity affirming practice viewpoint has the view that individuals would not have to mask or conform their ways in order to obtain acceptance from society, while the opposing viewpoint, the medical, is that reducing symptoms leads to easier functioning in life and within society. We'll be using 4 subtopics to debate. Number 1 is stimming, number 2 is masking, number 3 is eye contact, and number 4 is social interaction and forming relationships. Our group plans to use various clips to demonstrate what these behaviors could look like, and each side will debate and defend along. At the end, you will see a question and answer and a conclusion, and this debate should take about 35 to 40 minutes. Both pros and cons will be listed. Feel free to ask any questions. Since most of our viewpoints are related to the autism spectrum disorder, we have included a slide just briefly discussing ASD and some of the symptoms. An individual may have persistent deficits in each of these areas, including social communication, interaction, which goes into being nonverbal, developing, and maybe not maintaining relationships as normal as a neurotypical child. They could have restricted or repetitive patterns of behaviors or interests, or as we say, STEM. They have stereotyped or repetitive movements, highly restricted or fixated interests, or hypo or hyper reactivity to sensory inputs.
The neurodiversity movement is a social and philosophical viewpoint that embraces, validates, recognizes, and celebrates diversity of neurological conditions and cognitive differences. It challenges the traditional medical perception on conditions such as autism and instead views them as natural variations of the human brain. Jarsma and Wellen 2011 explains that advocates of neurodiversity argue that these differences contribute to the richness of the human experience and should be embraced rather than rejected. The neurodiversity movement calls for acceptance, accommodation, and inclusion while aiming to create environments that allow neurodivergent individuals to thrive on their own terms. It also challenges societal norms and stereotypes, encouraging a more inclusive and understanding culture. The goal of neurodiversity affirming practices is to promote a society that values neurodiversity as an integral part of the human experience. By challenging the stigma and developing understanding, the neurodiversity movement seeks to create a more inclusive and accepting world for everyone, regardless of their neurological differences. Neurodiversity affirming practices also embraces and supports the inherent diversity of neurological conditions and cognitive differences within humans. These practices recognize that neurodivergent individuals, including those with conditions such as autism, have unique strengths and perspectives. They aim to create inclusive environments that promote acceptance, accommodation, and accessibility to ensure that individuals with diverse neurological experiences can thrive. Neurodiversity affirming practices challenges stigmas, highlights individual strengths, and advocates for a more inclusive and understanding society.
Over the years, neurodiversity has become a topic of conversation. This graph just demonstrates the number of outputs that have recently been occurring. As you can see, in the year 2021, there was a major spike, as well as coming into 2023. The numbers are also predicted to continue to rise.
So the opposing viewpoint is going to be the medical model. According to an encyclopedia entry, the medical model takes the viewpoint that ASD is a neurodevelopmental medical condition that requires treatment, whether that is medication or various different therapies, including ABA, to decrease or cure symptoms. The medical model places deficits such as challenging behaviors or poor social interactions and communication skills over strengths. Most supporters of the medical model believe that most autistic individuals would be better off without their diagnosis. Some well-known groups that follow or support the medical model include Athletes Against Autism, Autism Research Institute, Center for Autism and Related Disorders, and Autism Speaks. According to Ethical Code 3.01, behavior analysts should do no harm, meaning treatment should focus on deficits that can contribute to harm, which can include physical harm to self, or bullying or views that can cause negative effects on the individual.
We did want to go over some ethical codes to consider while we are in the debate, cited by the BACB. We have 2.01, which is providing effective treatment. Behavior analysts prioritize clients' rights and needs in service delivery. They provide services that are conceptually consistent with behavioral principles based on scientific evidence and designed to maximize desired outcomes for and protect all client stakeholders, supervisees, trainees, and research participants from harm. We also have codes 2.04 and 2.05, which go hand in hand in masking, and making sure the client's best interests are reached in having the behavior analyst classify the nature and direction of their responsibility, keep all parties appropriately informed on matters, and develop and resolve the situation in accordance. Code 2.02 indicates that behavioral analysts identify and communicate who the primary ultimate beneficiary of services is at any given situation and advocate for his or her best interests. Additionally, we have code 3.12, which is advocating for appropriate services. Behavior analysts advocate for and educate clients and stakeholders about evidence-based assessments and behavior change intervention procedures. And lastly, 2.13, selecting, designing, and implementing assessments. Before selecting or designing behavioral change interventions, behavior analysts select and design assessments that are conceptually consistent with behavioral principles, that are based on scientific evidence, and that the best meets the diverse needs, context, and resources of client and stakeholders.
All right, kicking off the debate, we are going to start with the topic of stimming. For short, stimming is short for self-stimulatory behavior, and it refers to the repetitive movements, sounds, or actions that an individual engages in order to self-regulate or express their sensory needs.
Hi everyone, this is Rob, and I'm the father of 3 wonderful boys, all diagnosed on the autism spectrum. And I should point out that autism is indeed a spectrum. Those watching these different forms of stimming or movements may have subtle or wildly different experiences than my three sons, and that is totally fine. Having said that, from our experience and those we talk to in the autism community, we feel that most people on the spectrum will at least be able to relate to one or two of these stims. If you don't know what stims or stimming is, it is a form of self-regulation or stimulation. If you think of times where you've scratched an itch or sneezed, those were both in response to your brain communicating that you have a skin irritation or some foreign particles have entered your nasal cavity. Stimming is much the same. It is a response to stimuli or thoughts that are high sensory in nature.
Okay, so that's a short introduction of what stimming behavior can look like.
The neurodiversity affirming practices acknowledge that stimming is a natural and individual expression among individuals. By embracing stimming behaviors, it allows individuals to express their unique personalities and coping mechanisms without judgment. Stimming is often a self-soothing tool that helps neurodivergent individuals manage stress, anxiety, and sensory overload. Allowing stimming in appropriate contexts can contribute to improved mental health and overall well-being of the person that is engaging in the stimming. Neurodiversity affirming practices also creates inclusive environments that recognize the diverse neurocognitive needs. Accepting stimming is a valid behavior that promotes a culture of understanding and acceptance while also promoting a sense of belonging for neurodivergent individuals.
While neurodiversity affirming practices aim to reduce stigma, stimming behaviors may still face social challenges in certain environments. Neurodivergent individuals may encounter misunderstanding or discrimination, potentially affecting their social interactions. Stimming, if not managed appropriately, may lead to distractions in educational and workplace settings. Finding a balance between accommodating stimming and maintaining productive environments can be challenging for educators or employers. While some stimming behavior may pose safety risks, especially in certain environments. For example, if an individual headbangs as a self-stimulatory behavior, the individual poses harm to themselves, especially if the headbanging is completed with high magnitude and frequency. Ethical Code 3.01 responsibility to clients says that behavior analysts will act in the best interest of their clients. If a client is engaging in a self-stimulatory behavior that is causing harm, for example, severe irritation, redness, or bruising to the head from headbanging, an intervention should be put in place to decrease magnitude and frequency, or we will no longer be making decisions for the best interest of our clients. Neurodiversity affirming practices need to consider safety concerns and find ways to address stimming behaviors that could potentially harm the well-being of individuals or others in specific situations. Ethical Code 2.15, which relates to minimizing harm and risk to the client when selecting interventions, can also be thought about in this specific situation. We need to make sure our clients' health and well-being are being protected. If the individual is engaging in behaviors that could be harming them, appropriate interventions need to be put in place to protect them.
Okay, the next debate is going to be over eye contact. Eye contact refers to the behavior of looking into another person's eyes during a conversation or a social interaction.
Hi guys, it's Bree and welcome back to All Things Autism. This week's quick tip has to do with eye contact. Guys, 20 years ago when I started my training in this field, we used to run look at me programs, eye contact programs. It was the norm. It was the norm to sit knee to knee with a child, discrete trial training, right? We had our little sheet here to take our recorded data, and it was look at me, good looking, wow, eyes on me, look. And we were trying to maintain eye contact for a second, 2 seconds, 3 seconds. We were moving faces. We were putting our hands on the sides of their eyes to really try to get their eyes to look at us. Guys, those days are gone. Those days are gone. I want you to really listen to people who have autism. Not all, but many who are able to describe how uncomfortable, how painful, how awkward eye contact is for them. right? And we try to work on it. We try to maintain it because in our society, eye contact is the norm, right? It shows that I'm listening, I'm engaged, I'm having a social skill that's appropriate.
Okay, so there's a quick look into a little brief over both sides of having eye contact versus not.
Neurodiversity affirming practices allows individuals to engage in social interaction without the added pressure to conform to societal norms of sustained eye contact. This can assist with reducing social anxiety. Recognizing diverse communication styles shows respect for an individual's comfort level with eye contact, promoting a more inclusive and accepting environment. By allowing individuals to communicate in ways that feel natural to them, neurodiversity affirming practices allows a person to focus on the interaction or conversation rather than conforming to typical societal norms.
Someone with irregular eye contact or non-traditional eye contact may be faced with societal challenges, which can lead from misunderstandings or judgments from a person's level of engagement. In an educational or work setting where sustained eye contact is typically expected, irregular eye contact may be negatively perceived as a distraction or lack of interest in the topic. In certain situations, such as crossing the street or moving through crowded areas, lack of eye contact can pose a safety concern due to the lack of awareness.
Hi guys, it's Bree, and painful how
Hey, I'm Orion Kelly, that autistic guy, and this is Autistic Masking in 3 minutes. Autistic masking is basically the act of camouflaging, suppressing, hiding our true autistic selves from the outside world. In other words, we're masking, we're suppressing what's happening inside us. So we're presenting a different look that's potentially more comforting to the outside world, to the neurotypical non-autistic world. So in essence, masking is the act of suppressing our true autistic features, traits. So trying not to stim in public. Stimming for autistic people is used to regulate themselves, or if we don't, there's a good chance we could get dysregulated, potentially melt down. That could lead to burnout, but we force ourselves to try and not stim in public. I force myself sometimes to not get too excited or animated about talking about my special interests when people are trying to have a conversation with me. That's another pretty obvious thing you try to suppress. You also just try to imitate people around you, use their cues, and not that you kind of see them, but you're trying to copy what they're doing and how they're talking and acting. And yeah, so doing that is masking just being ourselves. But why?
So a true question into masking is truly, but why? As far as we know, masking can help encourage things, and it is the mimicking the characteristics they deem typical to those in their environment or situations that they have observed and learned. Mimicking the characteristics they deem typical is a good way for them to have an outlet, as the video just said.
Anderson Shavaria discusses the benefits to neurodiversity affirming practices and says that by validating the traits and personalities of those that are neurodiverse, we are promoting self-advocacy, teaching self-appreciation, love, and acceptance of all people. Expression of individuality can decrease the risk of depression and anxiety, lead to an earlier diagnosis, and decrease the risk of burnout. Seeking an understanding of traits and characteristics typically seen in neurotypical individuals can create supportive environments and opportunities that they may not have had otherwise.
Social acceptance challenges that come along with masking. Masking symptoms can help an individual feel safe in social situations, provide opportunities for social interactions and connections, and minimize the risk of bullying occurring. Educational and workplace distractions. Masking can improve workplace and education productivity by mirroring what other students are doing, therefore making tasks that involve the workplace or education easier to complete. Safety concerns, although masking may involve suppressing and altering communication and expression, hindering one's ability to communicate distress, comfort, and other important information. Masking also is able to help individuals perform appropriate behaviors that society would want to see, that they would need to obtain in educational and workplace environments.
Social interactions and forming relationships. This is a common occurrence in difficulties with social communication due to deficits in empathy, communication, understanding social cues, and many repetitive behaviors.
All people with autism can have their own challenges interacting socially with others, but when given the right support, all people with autism can thrive socially and develop meaningful and true relationships. Many children with autism want to play with their peers, but they might just need a little bit of extra support and guidance to get there. Examples of challenges that a child with autism might have could include asking their peers to play with them, understanding the emotions and feelings of others, negotiating turn-taking, noticing social cues, such as when somebody's no longer interested in the game anymore, or following a pretend play scenario. Providing structure and predictability through routines and visual supports can really help children with autism develop their confidence in interacting with others. You can also support a child with autism within their social interactions by providing structured opportunities to practice turn-taking, providing adult models alongside visual supports. An example of this might be a visual support that shows children how to ask someone to play with them. You can also include the child's interests and strengths in the interaction, allowing ample time to engage in their own play, explicitly teaching emotional recognition and understanding of social cues. For further support, please like us on Facebook, follow us on Instagram, subscribe to our YouTube channel.
So as we can see, that's a brief introduction into some ways that people and children can benefit from having social interactions.
There are various forms of speech to enhance a social interaction, and allowing an individual to use their own way of speaking during a social interaction supports individuality and promotes confidence. Appreciating the differences in social interactions and adapting the environment to the individual promotes positive well-being and happiness. Allowing an individual to be themselves, supporting their needs, appreciating their differences, and adapting the environment promotes inclusivity by providing a supportive environment.
Teaching correct social interactions can help an individual feel safe in social situations, provide opportunities for social interactions and connections, and minimize the risk of bullying occurring. According to an article written by Wilson and Dahlman in 2024, unique social situations or unique social behaviors and communication styles may be perceived as distracting in environments such as the school or workplace, typically affecting focus and productivity. In certain situations, such as workplace safety meetings, unique social interactions may raise safety concerns, and especially if others interpret them as lack of awareness or adherence to established protocols. Since stakeholders should always be involved and identified in and included in treatment, which covers Ethical Code 3.02 and Ethical Code 2.09. Stakeholders should always be involved in treatment, stating the struggles that an individual may face socially. That way we can programs with informed consent that increase social interactions. So the next few slides are going to be brief scenarios. So our first scenario, it has been 15 years since you became a BCBA and took on your first client. You are out shopping and notice two familiar faces, your first client and their mother. Their mother says hello with a friendly smile, while the now 19-year-old man is looking all over the place except in your direction. You and the mother start to engage in a conversation, and the young man is refusing to look even in a semi-close to your direction. He walks off towards the end of the aisle. The whole time the individual is engaging and biting his knuckles to the point where visible redness, which is perceived as the self-stimulatory behavior that was decreased to less than 5 instances a month from over 250 instances a month. The young man eventually joins the conversation saying ABA traumatized him and you should be ashamed for making neurodivergent children do things that make them uncomfortable. You think back to the programs that were put in place, wondering if all related to what would be considered the best interest of the client or ethical code 3.01. Programs are heavily focused on social skills, including looking at peers, manding to peers, and responding to peers. Was the prompted communication viewed as forced? Was the programming conducted in the best interest of the client? What ethical codes could be considered and why? Scenario number 2, you are completing parent training with the mother of one of your clients, and she said that she just joined a group for moms with autistic children. And a big topic of the Facebook page right now is how damaging ABA therapy is for children with ASD. The concerned mother states that she doesn't want any programming done that takes away or decreases traits that make her daughter her, and only focus on daily living skills. When asked about school in the future, the mother stated that she does want her to go to a public school when applicable. Her daughter has poor eye contact and joint attention skills. She will not engage with peers or near peers. She is often biting her knuckles to the point where they are raw and cracking, and bites themselves to draw blood. Her current treatment plan programming does have a correlation to most of these behaviors and skill sets. You immediately adjust the shift of your focus of programming, or do you explain the benefit of the current programming and how it can affect future goals of school and complete independence on crucial daily living skills?
When deciphering how to treat patients ethically, we must keep in mind the core principles and ethics for BCBAs to follow as set by the BACB. Core principle number 1 is to benefit others. As behavior analysts, we should strive to always protect the welfare and rights of our clients above all others. They should always be the center of their treatment plan when creating it. Core principle number 2 is to treat others with compassion, dignity, and respect. As behavior analysts, we should always strive to respect and promote our clients' self-determination to the best of their abilities.
There's a lot of
There
is a lot of research that supports both sides of the arguments as well. Our resources are cited at the end of our presentation. However, we wanted to highlight some key points from each point of view. In support of the neurodiversity movement, a study conducted in 2021 by Contreras et al. Highlights how the neurodiversity movement promotes inclusivity and celebrates individual diversity. At the same time, research pointed out that the neurodiversity movement may not appropriately address the needs of some people with severe neurological conditions who require more intensive support or interventions. The neurodiversity movement has expressed concerns that the medical view often overlooks the importance of accommodation for individuals' unique needs while focusing solely on symptom reduction. The medical model has been advocating for increased awareness of autism, promoting earlier and more accessible diagnoses, and organizing events such as Autism Awareness Month. This has contributed to a greater public understanding and engagement with the challenges faced by individuals with autism. Those who support the neurodivergent movement argue that the medical model tends to classify autism by framing it as a disorder caused by genetic defects or environmental harm. This perspective may stigmatize individuals with autism and overshadow their unique strengths and talents. A study conducted by Jarsma and Wellen in 2011 states that considering high-functioning autism as a natural variation rather than a disorder promotes a more inclusive society. This perspective encourages and recognizes that appreciating neurological differences without stigmatizing individuals with autism. With most research often comes we often come across limitations in findings and results. The limitations include potential challenges in balancing the diverse needs within the autism community while recognizing that additional intensive therapy may be required for some individuals. The medical model viewpoint is that autism is a neurodevelopmental medical condition, recognizing that treatment is needed to decrease or cure symptoms. This model places deficits over strengths that come with an ASD diagnosis. The overall goal of neurodiversity affirming practices is to promote a society that values neurodiversity as an integral part of the human experience. By challenging stigmas and developing understanding, the neurodiversity movement looks to create a more inclusive and accepting world for everyone, regardless of their neurological differences.
Okay, now we have some questions and answers that could have been received from our debate. Our first question is there a middle ground that accommodates neurodiversity affirming practices while still addressing functional challenges? The answer would be yes. A middle ground involves recognizing and celebrating neurodiversity while providing support for functional challenges. Doing this ensures that individuals can express their differences without having to conform to any social norms. Question 2. How do you navigate situations where social norms conflict with the desire for neurodivergent individuals to express their differences freely? While this can be very challenging, it is important that navigating involves advocating for better understanding from everyone, challenging norms and stigmas, and promoting inclusive practices that accommodate for diverse forms. Another question that arose was, how do professionals balance symptom reduction while respecting individual differences? Balancing involves a person-centered approach, considering individual preferences and needs while still addressing challenges. All of this with the goal of improving overall life and satisfaction in mind that aligns with the ethical code. Another question we received was, what evidence supports the idea that reducing symptoms leads to easier functioning in society? Many research has proven that interventions targeting symptoms reduction while tailored to individual needs can improve daily functioning, social interactions, and overall quality of life for neurodivergent individuals. And the last question from the audience is, how do neurodivergent individuals feel about the social or societal expectations to conform to what is deemed appropriate? Many neurodivergent individuals express frustration and exhaustion with pressures to conform, as it often leads to making their true selves disappear, which then contributes to mental health issues that arise later on.
In conclusion, the neurodiversity movement is a social and philosophical viewpoint that embraces, validates, recognizes, and celebrates the diversity of neurological conditions and cognitive differences. It challenges the traditional medical perception of on conditions such as autism, and instead views them as a natural variation of the human brain. Neurodiversity affirming practice supports this movement by providing a supportive and enriched environment where neurodiverse individuals can thrive on their own terms and challenges societal norms and stereotypes. Along with encouraging and creating more inclusive and understanding culture, neurodiversity affirming practices also closely aligns with the ethical code provided by the BACB to keep clients safe and thriving without causing controversy among the ABA community or neurodiverse individuals. Thank you all for joining our debate today. We hope you left with some key takeaways about the important role of neurodivergent movement and the importance it has on autism culture.
This is the ending references of our journals and what was cited on the slides.